A shot of Pfizer-BioNTech's COVID-19 vaccine, a healthcare worker in Alaska developed a severe allergic reaction. The person received the shot on Tuesday and began feeling flushed and short of breath. She was treated with epinephrine and other medicines for the severe allergic reaction. Officials ultimately determined the reaction as anaphylaxis.
Approximately 10 minutes later, we had one of our health care workers get the COVID vaccine. Approximately 10 minutes later, she felt flushed, and so took a Benadryl on her own, kind of sat up and sat around where we were monitoring people post-vaccine, and felt a little bit short of breath, so then was transferred to the emergency room, where I was the attending physician. When she arrived in the emergency room, she was feeling short of breath. She was not wheezy. Her heart rate was elevated, and she had a red flushed rash over her face and torso. I was concerned about an anaphylactic reaction, so gave her the standard treatment of a dose of intramuscular epinephrine, and she responded immediately.
US FDA has tweeted saying it's aware of reports of an anaphylactic reaction in a COVID-19 vaccine recipient. The agency will continue to work with CDC and Pfizer to better understand what occurred. US health authorities had warned doctors to watch out for rare allergic reactions when they rolled out the first COVID-19 vaccine made by Pfizer and Germany's BioNTech. 2 health workers in Britain had similar allergic reactions as well, causing the government there to tell people to avoid getting the shot if they had a history of severe allergies. A Pfizer spokesperson has been reported saying that they will closely monitor all reports suggestive of serious allergic reactions following vaccination and update labeling language if needed as well. Volunteers for Pfizer's clinical trial of 44,000 people were excluded if they had a history of allergic reactions to vaccines or components of the COVID-19 vaccine. US President-elect Joe Biden is expected to receive his first coronavirus vaccination as soon as next week in a public setting to install confidence in its safety. 78-year-old Biden is in a high-risk category for coronavirus because of his age. The state's chief medical officer, Dr. Annie Zink, has said that Alaska doesn't plan to change its vaccine rollout. The US is vaccinating some 3 million people this week with the vaccine and hopes to reach a total of 20 million people this month if another vaccine developed by Moderna is also approved.